So, where it gets a little bit tricky is when we have specialists involved that might be doing multiple uh, CPT codes, multiple procedures, or multiple tests. And, we don't want to get into a situation where, uh, there's tons of calculation to be able to figure out on the way out the door what that patient owes. So, really, the easiest way to do this, what I found over time is the easiest way to do this is to, of course, specific to your practice, is to, go through and determine, well, what is my average new patient? What is the average out of pocket for my average new patient? What is my average uh, amount going to be for my average established patient? So, as long as we don't have tons of different procedures involved, that's relatively easy to do. Where we come up with just an average dollar amount, and then we're going to, assess that patient on the way in the door. Maybe we say, if it's a little bit more of an intensive practice, there's, testing that's going to be more expensive. We might charge that patient $200 or $250, before they get back for their tests or for the exam, and then basically tell them after the fact, look at, we will, we'll settle this up basically once the carrier processes the claim. And once that carrier processes the claim, we will know, apply that, $200 or $250 payment that we collected up front. And then, basically, bill them the balance that's still owed, or refund them the money that might have been overcharged. So, this latter example of establishing a dollar amount for, new patients and established patients, it's a lot cleaner for your front office staff. The one thing, when you try to start billing folks, based upon, what was actually done, right then and there, it really assumes that, your provider is coding that claim while they're in the exam room, or they, have a scribe that's, doing this for them, or something along those lines. And that is pretty difficult to do, especially when there's multiple CPT codes involved.